On which point we will go to our very own resident GP, Dr. Luke Evans.
Thank you, Chair. And on COVID, Secretary of State, what's the probability of there being another variant that we may well need to take measures for?
I think there will be more variants. I mean, first of all, let me answer it this way. Will there be more variants? Yes, absolutely. I mean, there's been loads of variants of COVID, and most of them, thankfully, we haven't had to sort of worry about. I think we have probably the best surveillance system in the world in the work that the UK HSA does, and we saw that with Omicron. Your question about a variant that we'd have to worry about, I think there likely will be a variant that will be trouble in the future. And actually, by the way, there's already, we know about a subvariant of a sublineage, let's call it, of Omicron at the moment, BA2. We're not particularly worried about it, but just to sort of Dr. Evans, just to mention just how how we've just got to stay on top of this all the time. BA2, if you look at the case rates in Denmark at the moment, is spreading very, very rapidly. There's absolutely nothing to suggest that the vaccines aren't effective against it. It seems it's just as contagious as the original Omicron, BA1. But it's a reminder of the importance to stay vigilant, but also to stay vaccinated.
It's really helpful because, that being said, and we've heard it time and time again, moving to live with the virus. So what plan does the government have to avoid going into various lockdowns and to have a broad consensus of how we put measures in place for the future, should we need them?
Yeah. As I've said, the Prime Minister said we've got to learn to live with COVID. I think we're learning more all the time, and we've put a lot of that into practice over this recent Omicron wave. We will, first of all, I will be setting out, hopefully, next few weeks, a sort of plan in the spring, by the spring, a plan on how we think in government that we can learn to live with COVID as a country. And
that's really true. So you're going to come forward with a variant plan, which would have different, what level we put in masks, what level we put in social distancing, what level we need to close schools, all this. Can you talk us through how it would look?
I wouldn't describe it as a variant plan, or even necessarily on the kind of measures that you suggested there. But I think it will set out, taking into account everything we've learned over the last couple of years, what is it that we know is most effective, and then also understanding that. In the early days when we had the sort of lockdowns and things with the pandemic, that what are the sort of the knock-on non-COVID impacts of that as well on things like education, so children's schooling, college and university education, people's life chances, not going to work in the usual way, and all of that, and also the non-COVID health impact as well, your mental health impact, for example. So I think the things that we will focus on will be absolutely the pharmaceutical defences. So vaccines, I think, are with us to stay indefinitely, and I couldn't tell you today how often we would recommend a COVID vaccine, or exactly to what cohorts we would, but I don't think they're going away. Antivirals and other treatments, which again we have today for COVID that didn't exist when we first learnt about COVID, and also testing, I think, will continue to form a big part of our response. So those three things I would sort of put at the top of the list: vaccines, treatments such as antivirals, and testing.
So let me pull that together and say that's the pillars that you've got. It sounds to me, for the first time, we're going to be pulling together effectively the economic impacts, the non-COVID, as well as the COVID side. How will that be drawn together? Because you are the Health Secretary. How does that involve the Treasury, BEIS, all the other representatives, education of these areas, to fully formulate a plan that can deal with us and be sustainable for the future, to hopefully protect against the foreseen problems that we might have?
I think my department will lead on this. I will lead on this as the lead minister, but of course it will draw in from across government. It will be a government response to how we learn to live with COVID. And I've said, and I think I've said it recently just in the House in my last COVID statement last week, that we've got to find a way to live with it in the same way, let's say, we live with flu. And I'm not for a second sort of saying it's like flu. It's look at sadly all the deaths we've had from COVID, over 150,000 from the start. It's about understanding we do now have defences which we didn't have before, and just as sort of flu doesn't stop society and stop life, we mustn't let COVID do that anymore.
So my final question then is, with regards to that, how do we ensure that the NHS has the time to relax and deal with the backlog, but be able to scale back up yet again like we had over the Christmas period for the Omicron? That's a tough ask for the staff and the NHS in itself. What's the approach that you'll use to deal with that?
Well, it is a huge ask. I mean, first we must recognise that, because the NHS has all its sort of, let's say, its pre-COVID work to be getting on with, and also obviously that's increased as well. For example, the electives, the sad increase we've seen in mental health challenges as well, and of course the NHS has to deal with that as well. At the same time, it has to be preparing for living with COVID. And how do I see that? It will be set out in this plan, but to give you a sense of that, part of it is these pharmaceutical defences, so vaccinations. What we can't have every time we're trying to encourage people to take a COVID vaccine is we can't, if I refer to the previous question from Ms. Owen, we can't have asking GPs to stop doing their regular work. We can't have that. That can be an emergency response now, but in the future we've got to have a national, let's call it a national vaccination service that is able to deal with COVID vaccines as well as other vaccines without drawing in sort of workforce from the rest of the NHS. That's one thing, and the same applies, by the way, to you're making use of antivirals and testing and sort of having a separate process to deal with that. The other thing I think we need to think carefully about is what I would call sort of surge capacity. So we have again learned over the last couple of years. You would know about the Nightingales at the start of the pandemic. This time we did it a bit differently with the on-site Nightingales. But I think we've got to have some system of surge capacity that's sort of pre-planned, pre-thought through, so that it can sort of be in abeyance, when most of the time. But if there's a new wave and there's a concern around capacity, we can quickly switch it on.
Thank you. And from our resident